Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, how are Pennsylvania's hospitals and businesses doing? Stay with us. Pennsylvania politics and government in depth and in detail, and it all starts right now.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, let's start, first of all, we're going to take a quick look at hospitals, how they're doing in the state, and then we're going to turn to the business community. Gene Barr is here, one of our frequent guests, to talk a little bit about how Pennsylvania's businesses are doing, up or down, how has the economy affected them. Gene Barr is in the house, and he'll talk about that with us in a few moments. But first, Carolyn Scanlan, she's the president and CEO of the Hospital and Healthsystem Association of Pennsylvania and a frequent guest on the program. Hi, Carolyn.
Good morning.
All right, look, healthcare is in one of those strategic moments in time. Big transition, I think you would agree. Before we go to the Affordable Health Care Act, it's got to be implemented. Huge changes in the insurance industry. Where do the hospitals stand in the mix of all this change?
Well, it's probably helpful to talk about who the hospitals are in Pennsylvania and what they are. There are 257 licensed hospitals in this state, and over the last year, they admitted for inpatient care 1.6 million people. They treated 38 million people on an outpatient basis. Now, think about it. We only have 12 million people in the state, right. So hospitals are a core issue for healthcare. 6 million people in the emergency department, and we delivered 129,000 babies. Wow. That's a pretty significant healthcare and social component of the state. We also, however, provide almost 600,000 jobs directly and indirectly, and contribute billions into the economy.
I was going to say, you've got this economic and community interest involved in the basic operations of the hospitals, right?
Yes.
And you are the largest employer in many parts of the state.
We are in 55 out of the 67 or 66 counties, the largest or in the top 5. Mm-hmm. We are remarkably important to the communities, the $100 billion contribution to the economy. Right. And in all of this, we also deliver care to everyone, regardless of whether they have insurance or not, and $900 million of uncompensated care.
How is what has been the fiscal impact of a weak economy on hospitals? How are your hospitals managing that?
Well, a weak economy, meaning people more unemployed, meaning people have less insurance, because most people still get their insurance through their employment. Right. So if you have less insurance or no insurance, you either delay getting care, or when you get care, you can't pay for it. And so that becomes the uncompensated care or bad debt to the hospital. You also delay getting care because you're concerned about being able to pay. The money, yeah. And so sometimes your disease progresses or the illness progresses further than it otherwise would need to because you delayed getting the care you need.
And then by the time a lot of patients get to your facilities, their health situation has deteriorated largely because some of them are postponing visits to their doctors or not going to clinics, and you're sort of the repository of last resort.
With a safety net.
Is that correct?
With a safety net for care. So we see more people using the emergency department because we take all people, and maybe physicians in freestanding centers wouldn't if you didn't have insurance or couldn't pay. Yeah. We see more people, as you stated, that have the disease or illness that is a little further along. Okay. But nonetheless, hospitals continue to make sure that we have high-quality services.
Okay, we're going to run to a break. When we come back, I want to talk a little bit about how hospitals are doing with quality and patient safety. It's a huge topic. It's gotten a lot of more interest, particularly in the last 5 years when you and I have had a chance to talk about it. All right, hospitals are on deck, and then coming up, how is the business community doing? We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is presented by ReconnectPA.org, supporting a comprehensive transportation funding solution, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program with Carolyn Scanlan. We're getting an update on the status of Pennsylvania's hospitals, looking to the future as well as into the past. Before we get on to patient safety and quality of the care, Medicare and Medicaid are two huge entitlement programs that the hospitals rely extensively on as they provide services for the revenues to keep functioning. And some of those trends are pretty disturbing as you look outward. Talk a little bit about what you think are the long-range trends and how they're likely to affect hospitals.
Well, you know, we all know about the significant conversation that's been occurring in Washington over deficit reduction, the debt ceiling, all of the kinds of expenses and expenditures in Washington. One of the big expenditures is Medicare. And we often think of Medicare as the person 65 and older and the services that individual gets. Well, for Pennsylvania, because we're the third oldest state, hospitals take care of a lot of people whose payment is by Medicare. And every deficit reduction conversation causes further cuts to the payments that hospitals get for Medicare. And there's all kinds of technical ways that those cuts are occurring, but it's still less revenue, and it's problematic.
I noticed on the on the big debate over the $1.3 trillion that gets cut automatically, that a couple hundred billion of that will come from Medicare to providers.
Yes.
And no benefit cuts, just cutting the. Well, where does that not leave?
Well, for hospitals, of that number, over, because they do the estimates over 10 years, it's $1.6 billion.
Just for hospitals.
Just for hospitals, less payment, less revenue for services that the hospitals are delivering.
Yeah.
And so that is troublesome.
Well, in 2013, that will go into effect unless Congress, they do a redo.
A redo of that.
They redo of what they couldn't do. Of the sequestered money.
But it's hard to believe during 2012, with the election coming at the end of the year, that Congress is going to get anything done.
Right.
And so I see all of this continuing to play out in the kind of acrimony that we see in Washington.
All right, let's talk a little bit about quality and patient safety. That in the last, I'll say probably less than a decade, but within a decade, that's become a huge issue in the state. I know hospitals have, you've taken steps to improve patient safety. How have you proceeded?
Well, there are lots of issues around quality and patient safety. There are the protocol when you do surgery, or the kinds of things that you want to make sure are occurring in the operating room. There are things that occur at the bedside when the nurse and physician and others are caring for the patient. All of them have certain kinds of outcomes, and one of the benchmarks, or one of the things people look at now, is the infection rate that comes out of surgery or other kinds of procedures. We indicate from the kind of reporting that we do to the Department of Health and other state agencies that the infection rates in Pennsylvania hospitals are lower than anywhere else in the country.
Wow.
We have done a remarkably good job, and we're going to do even better. We just received the association, on behalf of our members, an almost $6 million contract to work on 10 key quality areas with our hospitals over the next 2 years to reduce infections and to increase the kind of quality that's occurring. We think we do a great job. We want to do a better job.
All right, before I let you go, I want to talk a little bit about Affordable Care Act. Critics of it call it Obamacare. The technical name, as you know, is the Affordable Health Care Act, its implementation. Where does that stand in Pennsylvania as we speak now?
Well, you know, certain things were implemented. We have a higher risk pool for people to buy insurance who can't buy it elsewhere. Kids up to 26 can be on their parents' health insurance policies. Right. The State Department of Insurance is beginning to proceed with the establishment of what's called a health insurance exchange, which would be a way that people could go in and compare prices to buy insurance and benefits. We know that the hospitals and insurance companies in this state are beginning to look at how they configure themselves into what are called accountable care organizations and linking insurance and quality and providers. And ultimately, you know, the U.S. Supreme Court is going to hear the issue around the constitutionality of the mandate of everyone having insurance. They're going to hear that in March, probably decide it by June or July. If they do deem it constitutional, and most constitutional scholars think they will, then in 2014, we expand the number of people who are eligible for Medicaid and the number of people who have to buy insurance. And from a health care point of view, that's a good thing, because we talked before about people who delay getting care because they don't have health insurance. People should have health insurance. The debate clearly is about how you pay for it and how you mandate it.
All right, well, look, great update. You'll come in from time to time and keep us posted, particularly on the Affordable Health Care Act implementation. The nuances to it is complicated, and ultimately it's going to affect, 12 million Pennsylvanians in one way or another are going to be affected by it. All right, let's talk business. Gene Barr, the president of the Chamber of Commerce, Pennsylvania Chamber of Business and Industry, to get the full title out, will be here in a moment, and we'll check on the health of the business community.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Healthsystem Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, Gene Barr, who's a frequent guest on the program, the president and CEO of the Pennsylvania Chamber of Business and Industry, is here to help us do a quick update on the status of the business community in the Commonwealth. Gene, recession, some businesses doing better than others. What do you hear from your members? What's the general outlook?
Well, they're still coming back. And I think last year was a pretty good year from the perspective of the state. There were certain things that were done that were good. For example, legal reform. We finally got some implementation of legal reform. We finally made some modest improvements on the unemployment comp problem. What's also important is the things that we didn't do. When you think back to the fact that 20 years ago, we had a huge budget deficit, raised taxes this year, or 2011, we had a big budget deficit. We didn't. So I think that's a big thing. In Pennsylvania, interestingly enough, there's a Forbes rating of businesses. We improved 4 slots of what the business climate is. It is good. Some of it, again, is what we did, and some of it is what we didn't do. You can make progress because other states raise taxes when you don't. And I think that's a little bit about what we're seeing. From the general economy, we still have some improvement to do.
Yeah, I mean, the unemployment figures, this is the first recession where I think they've been lower than the national average, this current recession. I think usually, more typically, we're above the national average.
Yeah, we didn't go up as bad. We didn't have the explosive growth other states did. In all honesty, what's helping us is the Marcellus, and it's helping us not just in the Marcellus areas, but in areas outside that. We just finished a series of forums across Pennsylvania, and what we're seeing is, interestingly, not just obviously growth within the industry, but growth in other places. We're seeing reductions in the cost of natural gas, which helps consumers, it helps businesses. We're seeing businesses that supply products and services. All these things are positive and help Pennsylvania in this economy here.
Now, from your point of view, as we look at the return of the legislature, they left undone a significant portion of Tom Corbett's agenda, Governor Corbett's agenda. And you know, each chamber has its own concerns and its own priorities. What do you think are the 2 or 3 big things that, if you could wave your magic wand, you would have the legislature do?
Well, you hit on exactly what the issue is. That is, even though they're all Republicans, obviously they're different people, and each of them has their own issues, their own priorities. I think that what I think we'll see done, what I'd like to get done, is a whole bunch of things, and some of them coincide. I think Marcellus will finally get done. I'll be blunt. I was surprised it wasn't done last year. There's a lot of moving pieces to it. It's not just whether we do a fee and what the fee is and who collects it. It's the environmental side. It's what we do with the local ordinances. I think you're going to see that done. Obviously, the governor wanted education done. There are certain folks who wanted privatization of the state stores done. From our perspective, all of those things are crucially important, and now you've got, of course, transportation rearing its head again, and transportation needs to be done in Pennsylvania. We need to work on our infrastructure. Anyone who drives the roads, uses mass transit, knows we have issues with our infrastructure.
Yeah, I mean, there have been a number of studies done. You know, one estimated we needed about 1.6 or 7 billion a year. Others saying we need as much as 2.5 billion.
Exactly.
Yeah. So, notwithstanding the studies, I think there's a general consensus. But Gene, can that get done? You can't pick up a billion here when the state is, at the moment, looks like it will have a deficit in the current operating budget by $500 million. Does the chamber support the fees and the hikes in the oil franchise tax to pay for this?
We actually
do. You have a position on it?
We actually do, and the reason is this. If you look at things that state government ought to be doing, or government in general ought to be doing, our infrastructure is one of those core functions that we believe falls into that. So we do support, because here in Pennsylvania particularly, when you look at the gas taxes, the taxes you pay at the pump, they really function as user fees because they're constitutionally protected. They must go into roads, bridges, and highways. That's the reason that we do support that. Obviously, there's concerns about that, particularly in an election year.
Yeah. You mean whether the votes would be there to increase license fees, and some of those things have not been done for a decade.
It's been more than a decade at this
for
point.
License fees and registration fees.
It's been probably about 15 years
really?
that we've done that. Now, the House Democrats have said they'll come out and they'll help get votes. We'll see how that goes. I know that Governor Corbett, understandably, has concerns over implementing tax hikes in any time, particularly this year and in this economy. So we'll see how that progresses. All
right, we're going to run to a break. When we come back, I want to talk with Gene Barr about some of the intricacies of Marcellus Shale and a couple of other issues that are important to the business community. Back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Welcome back. Gene Barr, the president of the Pennsylvania Chamber, is in the House. We're chatting about the business community, the outlook for the future, and we're in our final segment. Gene, Marcellus Shale, no doubt, is a huge job producer. There's all, as you know, there's controversies over the environment with it, over what to do with fracking water, and it's become maybe the single most dominant issue that we've seen in our state in maybe a decade. But what's the big debate in Harrisburg, among the issues, and there are many, as you pointed out, is should there be an impact fee? And if so, what the rate should be? And then who gets to decide if it will be implemented? Should it be done at the state level or should it be done at the county level? What's your sense about what's going to happen with this?
Well, I think it'll get done, and I think there's a reason why, as you note, it's the biggest issue we've dealt with in a decade, because we believe it's the biggest economic opportunity Pennsylvania has had in 5 or 6 decades. When you look at it, what it's delivering to consumers in terms of cheaper natural gas prices, when you look at what it's doing to businesses, not just in the drilling, outside some of the forums we did. We had a Lancaster County business talk about the fact that they went out and they hired people. They bought 75 pickup trucks from a Lancaster County dealer. That's what it's doing. I think that eventually you're going to see the impact fee. I think there'll be some, obviously, decisions made about who collects it and what those numbers are, and I think that'll get worked out, the environmental issues, as well as this whole local ordinance thing,
Right.
because other states have figured it out, and other states
Right.
have created a better economic climate at this point for that. We need to make sure that we do that. We can continue the benefits that activity is doing here in Pennsylvania.
Right. One of the other issues that keeps arising is the sale of the liquor stores. We've talked about it on this show many times. Several governors have tried it unsuccessfully, and now there's a new proposal that in a sense is a hybrid, right? You would have the state stores still continue to sell spirits, but beer distributors will be able to sell wine, and then other retail vendors will be able to expand the the cases of beer that they can sell. I think I got this right. Does the hybrid have any better chance than the version where you would just get rid of all the manufacturing and wholesale and retail operations?
You know, keeping this in, whether this is the slow death of LCB or whatever, I mean, it's interesting because even the folks who don't want it have opposed this, which to me says they just don't want competition, period. And I think that, look, Pennsylvania needs to get out of the liquor business. You can't be in the process of enforcing and encouraging the use of it at the same time. 48 other states have figured it out. Pennsylvania has no more business being in the liquor business than they do, whether it's the pharmaceutical business or selling automobiles. We need to get the state out, and it needs to be done fairly quickly. When you look at how much it returns to the state, does it bring a profit back? It does. But when you look at it, that profit has been declining in recent years, and we've got to figure out how we do that and how we get the private sector helping the consumer relative to that perspective.
In general, what would you say is the most serious problem that the business community faces? Taxes, regulation? I mean, you hear from your members all the time.
We talk about so many different things, whether it's legal reform, and we need to do more of that, whether it's apology legislation, whether it's venue change, which is businesses getting pulled into courts in Philadelphia when they shouldn't. But one of the things that's interesting that we hear so much from our members about is they can't find either the number or the right mix of people they need to run their businesses.
Yeah.
They don't have the talent. Oftentimes they turn the jobs down because they're still collecting unemployment comp. That's a minority of people, but that's certainly out there, and we passed legislation last year that will help to address that. But this whole workforce issue is one that needs desperate attention here in Pennsylvania.
Is it the question that the colleges and universities, some of them are just not aligned to the real needs of the workforce? Do you think there needs to be more alignment in that way?
I think you hit on a big piece of that. A lot of that is for years we've told kids they need to go to a four-year college. In reality, when you look at the jobs that are out there, they're much better served in many cases by going to a 1 or 2 year program, getting an associate's degree, particularly getting something that's technical. We need to get our kids more into science, technology, engineering, and math. We need to encourage them to go there. There are so many job opportunities in that, and many of them don't require a 4-year degree.
Yeah. All right, well, you'll come in from time to time, as you always do, and keep us updated. Optimistic about the economy next year?
I think it'll be better.
You think it will
It'll
be better? So unemployment is lower than the national average here. You think job creation will pick up?
For a couple of reasons. One, I think that we've done some of the right things. We're headed in the right direction here, and let's keep that going.
All right. Thanks for watching this edition of Pennsylvania Newsmakers, and as always, stay well.